More than 2.2 billion, that means 200 crore plus people have goiter. But the sad part is very few people know about goiter. So do you know what is goiter? If not, then stay tuned with me because we are going to discuss about goiter in today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Now before I continue this video, one important information. If you want to watch this video in Hindi language, then on the I button and below in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप आज के इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's continue our today's topic, and that's about the goiter. What is a goiter? So if I have to explain you in a very simple language, then goiter is nothing but an enlargement of the thyroid gland. Yes, see, each and every individual has a single thyroid gland in our neck area. This gland has a shape like a butterfly, or what we call it as an alphabet H in English. So this thyroid gland has a two lobes, right lobe and a left lobe, which is connected by a horizontal tissue called an isthmus. So this is a thyroid gland. When the thyroid gland enlarges, it becomes bigger in size, it's called as a goiter. So the moment I see patients of a goiter in my clinic, they have many questions running in their mind. What are the most common questions? Let me answer them so that you also get a knowledge. So the very first question they ask is that, so doctor, which part of the thyroid gland will develop into a goiter? So see, it's difficult to say. The goiter can come either from the right lobe or left lobe, or even sometimes from the isthmus. There is no special area in the thyroid gland where goiter develops. It can develop from any part of the thyroid gland. Second question is that always the goiter comes from one particular part, or it comes from the entire gland. See, many of the times the goiter can come from one single area, and then we call it as a nodular goiter. But many times the goiter can happen all throughout the thyroid gland. What we call it as a simple or a diffuse goiter. So it can happen from one particular area, or it can happen from all throughout the thyroid gland. Third question is that, doctor, is this disease a serious condition? Answer is maybe, may not be. See, goiter can happen due to many reasons. What are the reasons? We'll find out in the further video. But sometimes the goiter, if it is due to thyroid cancer, then yes, it can be a serious. So with that, the next question is goiter means I have a thyroid cancer? Answer is may not be. See, so many times we found that the goiter is usually a benign and not a cancer. Only few times it turns out to be actually a cancer. So if you have a goiter, my advice is don't worry, go visit your nearby endocrinologist doctor, investigate, and then only you will be able to say whether it is a serious for you or not for you. Okay. Another question is that, doctor, is the goiter, is it a temporary or is it going to be permanent? Again, it depends on what is the cause of the goiter. Many times if your thyroid hormone is in imbalance, and then if you have a goiter, the moment we correct it, your problem solves. So we can say it was a temporary issue. But many times it does not respond to the medication. Then we can say it can be a permanent. Again, a commonly asked question, does the goiter remain same throughout, or will it increase or decrease? Answer is all three can happen. Many times if we give you the medications, they respond well and your goiter reduces in size. Sometimes when you don't do any treatment, it can go on and it can increase, or sometimes it might remain at the same level. So again, it depends on individual to individual medical cases, right? Now, of course, because the goiter is visible from outside, the people get scared, and the very commonly asked question, doctor, how common is it? Am I the only one who got the problem, or are there plenty many? Answer is, there are plenty many. See, in fact, if we talk about the worldwide, the prevalence of goiter is nearly 15 to 16%. That means it is quite a common problem. So don't worry if you have the problem. Please don't worry if there is a problem. There is always a solution to it. Okay. Now, so if we talk about the particular country of India, then India, there are certain states where the goiter prevalence is very high. States like West Bengal, Jammu Kashmir, Kerala, Andhra Pradesh, Tamil Nadu. These are the certain places where the goiter is found in a large number compared to the other states. Okay. Another question is, why does a goiter happen? See, goiter is actually an adaptive response of the thyroid gland. Let me elaborate it and make it simple for you to understand. See, our thyroid gland, inside it contains small cells, and these cells are called as follicles. The primary job of these follicles is to make a thyroid hormone like T3 and a T4 hormone, and all of these thyroid hormone gets collected in the form of a colloid. But sometimes what happens, if your thyroid gland does not produce the right balance of the hormone, then in that case this signal reaches to each and every cell, that is the follicles, and in response to this signal, these follicles either they increase in the size or they increase in the numbers, and in both the kind of a situation your thyroid gland becomes bigger in size, and that's what we call it as a goiter. So goiter is actually an adaptive response of the thyroid gland. Alright. Having said that, let's understand what are the causes of the goiter. Okay. See, causes of the goiters are plenty many. I'm going to discuss about the most common causes. So that the very first is the iodine deficiency. Yes. See, iodine is one of the very important trace element, micronutrient, mineral, which is important for the proper and a good health of the thyroid gland. If for any reason your thyroid gland do not get a sufficient amount of iodine, then the iodine deficiency will start affecting the thyroid gland. And in response to this, your thyroid gland will work more and more harder and harder to make the hormone, and in that adaptive response, the gland will become bigger in size and land up into a goiter. So, iodine deficiency is the worldwide most common reason of the thyroid goiter. Nearly 2.2 billion people across the globe is suffering from the iodine deficiency. The good news is that you can prevent this. Yes, by very simple method, having a right kind of a salt. Yes. So since we are talking about the salt, I have made another video on that what is a right salt for the people who have a thyroid problem. So if you are interested, do watch that video. The link is there up on this on your I button. You can click there and watch that video also. So from the time the governments have made it ensured that the salt gets iodized, the rate and the incidence of the iodine deficiency goiter has come down to a larger extent. So that is the first and the most common cause. The second cause of the goiter is the Graves disease. Yes. What is Graves disease? See, Graves disease is actually a type of a autoimmune health problem where your entire body and their immune system is making antibodies and trying to destroy your gland. And when a person has a Graves disease, they also have a higher level of the thyroid hormone and lead into a hyperthyroidism. So when a person has a high level of the thyroid hormone, this hyperthyroid situation can also give you a goiter. Third reason is the Hashimoto's disease. Hashimoto's disease is also one of the most common autoimmune problem of the thyroid gland. And when a person has a Hashimoto's disease, the thyroid gland becomes very slow, very sluggish, and makes a very little of a thyroid hormone. So if you have a hyperthyroidism or if you have hypothyroidism, both the situation can give you a goiter. Fourth condition is the thyroid cancer. Yes, so when you have a thyroid cancer, you can have a goiter. In fact, most of the time, the person who have a thyroid cancer, their goiter is usually of the nodular goiter. By the way, what is thyroid cancer? What are the types of the thyroid cancer? What are the symptoms of it? How do we investigate and treat it? I have made an entire playlist on that. So if you are interested, watch that video. You will get a lot of knowledge on that. That is the fourth cause. The fifth cause is the thyroiditis. Yes, thyroiditis is nothing but the inflammation or the swelling of the thyroid gland. So when you have a thyroiditis, you can have a goiter. Another common reason is the pregnancy. Yes, many of the times when a woman is pregnant, at that time there is a very high level of another hormone, what we call it as a HCG, that is human chorionic gonadotropin. So when you have a high level of the HCG hormone, that can also stimulate thyroid gland, and your thyroid gland can become bigger in size and have a goiter. Many times the moment a woman delivers the child, the goiter also disappears. And sometimes it can remain and that lady can develop a thyroid imbalance later in the life. Another reason of the goiter is a no reason. Yes, no reason. This we call it as a sporadic goiter. So once a person has a goiter, we do many testing and examinations. By the way, what testing and how do we actually diagnose and detect it? I have made another video which is going to be the part 2 of the goiter series. Watch that video. But when we do all those testing and we find out that there is no specific reason why a particular person has got a goiter, this we call it as a sporadic goiter, where we don't know the actual cause of the goiter. So these are the most common causes of the goiter. So till now we saw what is goiter and what are the causes of the goiter. Now let's see what are the types of goiter. Yes, see, goiter is classified in many different ways. So first type of classification is where how much is a thyroid hormone in your body. If your hormone level is very high, then we call it as a toxic goiter. And if the thyroid hormone is normal, what we call it as a euthyroid, then we call it as a non-toxic goiter. So based on the hormone level, we have a toxic goiter and we have a non-toxic goiter. Based on the type of the enlargement, the goiter is classified in 4 different types. The very first is a simple goiter. We also call it as a diffuse goiter. Okay, what is it? So when a person has a simple or a diffuse goiter, the goiter has developed all throughout the thyroid gland. Right lobe, left lobe, isthmus, every part of the thyroid gland is involved. So this we call it a simple or a diffuse goiter. In fact, when we touch and feel the goiter, it's usually very smooth surface. So this is the one of the common reason of the common type of a goiter. Second goiter is a nodular goiter. As the name suggests, in this type of a goiter, there is only one single nodule. A nodule is actually nothing but a lump, which can either have inside a fluid or it can be solid. So this nodular goiter can also be present. In fact, nodular goiter is found more commonly with the thyroid cancer. So when any person has a nodular goiter, we always investigate it in a larger extent to know that what is the actual reason of the goiter. Third type of a goiter is a multinodular goiter. As the name suggests, multi means many. Here there are many small lumps, and the entire thyroid gland can have that lumpy or a bumpy feeling. So many times when the patient comes to the clinic, they also say that, ma'am, when we touch and feel our neck area, we find that there are a lot of lumps and bumps. So this is nothing but a multinodular goiter. And we can also find out about multinodular goiter when we do the thyroid scans also. And the fourth type of the goiter is an endemic goiter, or what we call is a colloid goiter. Endemic goiter usually happens in a one particular area or the local region, and that's why we call it, it's an endemic of a particular area. Most of the time, the iodine deficiency goiters belong to the endemic goiter. So today we saw about what is goiter, what are the types of goiter, and what are the causes of the goiter. In the second video, we will talk about how do we detect the goiter, what are the treatment we do, and what are the symptoms can happen to you. So if you have goiter, do watch that part 2. This will give you a more detailed knowledge. Thank you for joining me till now, and I hope that you have subscribed to my channel. If not, then please subscribe. Your subscription not only gives me the encouragement and to produce more and more helpful videos, but it will also help you enhance your medical knowledge, especially that of the hormones. If you have any of your personal question whose answer you are seeking for, write your question below in the comment box. I try to read and answer them as early as I can. We will meet again with some new good, useful information. Till then, take care of yourself. Namaste.